if we could have separate meetings, particularly over the, over the next few months with the CAP members from Hoosick and in Petersburg from Newburgh, because the two sites are very different, and the recruitment needs and the engagement is going to be very different. And I was reflecting on the last two CAP meetings, we didn't really have as much time to spend with all of you. And so we jumped on it. And so I apologize, I didn't think of it sooner. But we'll move forward, and maybe every 6 months we might have a joint one just to share common information. But over the next few months, definitely we'll have some separate, and we'll reach out and schedule, and we'll talk about processes and what works well for you, particularly as we get going. I have
a lot of meetings with Ed, and we're on different committees together, so we're always in touch anyway, so that works.
That's good. Yeah, he showed it, because I know Senator, you're having a meeting with Schumer's office.
Yeah, we had it today.
You had it today? Okay, so that's good, and I knew that was happening. So I'm glad you're bringing voice together, because your communities are, obviously have similar exposures and different needs. So it's good that you're showing a united front on these things. So
and we did mention the site study, in our
I
presentations today too. So
yeah. Because again, always making sure there's funding available to keep up with the health study is always a good thing. So thank you for that. My goal today, we'll give a brief update of where we are, and then really I want to hear your ideas. There's some specific questions I have regarding recruitment, but your ideas for community engagement, how to be in the community and work with the community and answer questions, and your thoughts on some of the meetings we should attend. And I have a couple questions specific, especially with the school board and the school district. So I'm glad Emily was able to join us. As you know, the letters did start to go out in Hoosick Falls. We will send the batch to the Petersburg folks in their own batch, and we're going to wait a few weeks on that. We want to get a few weeks under our belt with Hoosick, and also we want to time it and let you know so that we can coordinate when that whole batch goes out together. Right now in Hoosick, we're sending 75 invitations a week, and I think we'll stay at that number for a while. And if we need to speed it up, we will. But if we do that, we should be through mailing the invitations by June, July. With the anticipation, and then that allows us, because we have a smaller staff at the clinic, that allows us to be able to do, I think we said 16 visits a week when we're at capacity. And so that's a doable number. And what we monitor the numbers every Monday. We look at where we are in terms of who we've scheduled, how many visits have been completed, any issues that have come up during the clinic visits. But for now, that's, and again, we've just started the, and we'll get the feedback from Lorene and anyone who comes in for the early appointments to work with that. But that's where we are with the letters. And so again, helping us get the posters out and get the flyers out and answering questions, referring people back to our PFAS email and our 1-800 number would be great. And we are doing the questionnaire, partly because of COVID, partly because of staffing, and it just helps speed things along and speed the visit along. We'll do the questionnaire over the phone with people, so they don't have to stay at the visit for additional time to complete the questionnaire. So we will be working with people on that and scheduling a time to have that questionnaire done. So I don't know, has anyone heard of anyone who's received an invitation, or have you had any questions?
I have not yet, but I did have one question. The images you forwarded that, that show, the little postcard thing and the sheet. Is there any way you can pop those into a JPG format? Because I can't copy them to put them on Twitter or Facebook or everything. I tried I don't have like that kind of software.
Yeah, so. No, here. So, and Gina's on, we're actually we're coordinating that with Gina at DOH, and we'll be, so that we can share things via, I know you have your Twitter site and share things digitally with folks, and we're working on some whatever the format is. So that's doable, and we should get that. We'll get that to you as soon as we can. But
Great.
we did think of that, and we'll definitely share those. And we also have some just suggested, even like little quotes and statements and things related to the study. If you wanted we put some of those out on our Facebook, but if for those who are tweeting and want to share that way, we could also provide some language if you want to use that as well. So we'll put a package together. We actually have a meeting on Monday, I think, to talk about that, and then we'll get that to you as soon as we can.
Great.
And we do appreciate that, because just provides us a reach that otherwise we wouldn't be able to get to. So that's really helpful. And again, any ideas if people have in terms of who we should be reaching out to, if there are any other Facebook pages we should link to, or organizations we should talk to, let us know that. In terms of, let me start with my question so I don't forget, related to the school. So an important component, we obviously want to let the school board know that the study has started and answer questions with that, but we would also like to meet with the superintendent and the school, because an important component of this study is to seek consent, have the parents sign consent for us to abstract information from the school record. This is particularly for the children who have IEPs and special accommodations, because this will help us look at the neurobehavioral effects as well, in terms of their association with PFAS. And so this will take some coordination. We don't plan on doing the abstraction right away. We want to work in coordination with the school district, because we don't want to burden them. But we will get, and obviously we will only do it for those that the families actually give us consent to do that. So we wanted to both let the school board know about the study, but then I think we need to arrange a meeting with the superintendent to more specifically talk about the second issue, because we know this sometimes can take some time. So that was one question we had today, is how best to, when would be a good time to meet with the school board, and how best to reach out to schedule a more in-depth meeting with the superintendent.
So our next meeting, I want to say maybe the 13th. I have to look.
Okay.
Let me just check real quick. I have to go like way back. I did let the board know that you planned on presenting in the near future. So if the date in February works, I can get you on the agenda.
Let me double check. I know we have, so.
I didn't think I took that many pictures, but apparently I do.
So February 13th is a Sunday?
Okay, yeah, that's not it.
Okay.
Problem is I have it screenshotted in my phone. All right, so it is February 17th. I wasn't that far off.
Yeah. That works. Are you meeting are they meeting in person or via Zoom?
As of right now, I'm not sure. Our last one was Zoom due to the increase in cases, but I'm thinking this one most likely will be in person, because I haven't heard of it being an issue.
And that's are they at 6 o'clock?
6:30.
6:30. Okay. Yeah, no, that's definitely doable. Now, is it set up as a school board meeting? I know both with the Newburgh, but also my own district, I can there's no Q&A. I'm only allowed to just talk about the study, or is there what do you suggest?
The board will ask questions.
Okay.
Basically, like the way it's set up, like the public, if you want to go into the technical rules, but we're a pretty good bunch, so we don't like not follow the rules, but we also don't, we just won't debate with people.
I don't need a debate.
Yeah.
So
if you wanted to, just mention to Pat that night that, you'd like to have a conversation with
Sure.
him,
Okay.
you could do that publicly, you could do that privately. I can always send you his email, which
Okay.
would probably be the best way to start the conversation, just because I know he's extremely busy.
Yeah. Okay.
But he's great. He just took the chair position, the co-chair position on the CPWG, right, Lorraine?
Okay.
So yeah, he just keeps adding things to his to-do list.
And
Yeah,
so,
he and
okay.
Michael are now co-chairs of the CPWG. I couldn't do it again because of conflicts, because I joined Just Green and then I'm in the Earth Justice suit with EPA, and Brian's moving. So out of our district. So we had to sadly relinquish our seats.
that I'm actually presenting to CPWG on the 22nd,
Great,
at your
great.
22nd meeting. Emily, in terms of scheduling on the agenda, should I just send an email then to the contact, or do I go through you, or what do you think?
No, I'll just text Kate, his secretary, tomorrow, and have you added to the agenda.
Okay,
It'll
thank
be
you very
quick
much.
and simple.
Okay. Great. And I'll just plan, I'm just giving a very brief, I'll bring fact sheets and flyers with me. And I'll just, give a brief overview of the study and then answer questions as they have them. And then I like your idea. I can send a follow-up email to the superintendent and the school board and ask, if we can explain this additional component, and then we'd like to coordinate with them as possible in a separate meeting.
Sounds perfect.
So just in terms of ideas, we are definitely interested in scheduling an open house. We do have to schedule at a time, we have to watch the COVID numbers, because to have large gatherings, we have to meet certain conditions. The good news is the numbers are coming down. So I think as we maybe, a few weeks out, maybe later into March, it might be a good time, and that might work better anyway because of weather. But definitely, I hear you. I think having an open house, there was some interest in having some of the local reporters come through as well as the town board members. And so we're certainly, interested in scheduling that with you and talking about how best to, what date to choose, if we should coordinate with another event in town or have something going on. We know it's close within walking distance, and then coordinating with our clinic staff. So that's definitely something we're interested in, but we wanted to talk if you had other ideas. We've heard that you do a bang up St. Patrick's Day parade. We didn't know if we should have a table there to answer questions, if you do that in conjunction with the parade.
Think Las Vegas Strip with everybody walking. It's the biggest holiday. And yeah, it is. It's not just the parade, it's all the activities also that are going on. And that, so I don't know, depending on the weather, where you could set up, or, if things are going on in the armory, maybe, which they have had, that would be cool.
Do people typically have tables there or have a presence, or?
Emily, when was the last time you went to, that wasn't the bar? Because
I'm actually not a fan of parades. My godmother used to force me in them as a ballerina. So I don't typically go to the parade.
I know that they do have activities that at least they did last year that went on at the armory, whether they were sort of Celtic games or I don't know, there was something, but we can, Kevin, O'Malley on the village board is usually in charge of all of that. So I can reach out to him and ask if they are planning anything at the armory.
Yeah.
And maybe we can get some stuff in there just laid out. I mean, it might, gi- all right, so let's be blunt. Given it's such a drinking day, I don't know how much participate or people will
Yeah,
pick it
no,
up, but
yeah, it's an eggs and kegs thing here that they have. Yeah,
but
and
we
again,
should
we
get the
just threw it out
posters in the
there.
armory too. So
Yeah.
yeah,
So it's all about what you think might be worth but if there were other events
I'd
like
put at
that.
least the information out, in a couple piles anyway.
Okay.
If people pick them up, great. If not, at least we can have them posted too in the armory so they see it.
All right.
But
Are there
yeah,
other events like that or things where we could come and provide, or are there any Earth Day events or
not
things?
so much till like
Yeah,
the band concert season starts, whatever, or when it starts warming up, when more people come out.
yeah,
I mean, there's like, and again, it's at like the local establishments. There's bands around I don't know if the establishments would let me put this information up on like their bulletin board. I plan on
Yeah.
asking. I don't know how thrilled they'll be about that, but maybe they will, maybe they won't. But I don't know. There's like trivia nights. I mean, so it depends.
yeah,
But that's why I want to get them at least every, because like our local, our grocery stores, our Cumbies, our, Stewart shops and stuff. Well, I want to get them all around there because
yeah.
everybody goes to those. So that's maybe, I don't know if the Dollar General even has a bulletin board. They might, but I want to get them into the stores where I know everybody goes. And
Okay,
again, on Facebook, I already had a few people reaching out to me.
great.
And I don't post on Facebook a whole lot, so that was cool.
Yeah.
Um,
What about the library? Do they put stuff out on their social media, and do they have an area to hang things, hang posters? And
I'm sure we can find a spot because they do like kids events,
yeah,
so the parents would be able to see them.
There's also some upcoming, like there's a little craft fair coming up. Like that would be something good too.
Okay.
Where's that
I'll
at?
find out. Music Nutrition is doing it so I'm assuming it might be there.
Oh, the new
I-
place. I haven't even been in there yet.
yeah, they like a couple small people in town like go and they have like just a little craft fair. So that would be a good spot. Nobody will be drinking. Just
Well, and it's a
nutritional
nutrition
drinks.
place, so that might be nice.
no, that's a great idea. Okay, those are really good. So I think we can definitely plan some sort of open house. We'll just keep an eye. Well, it's a little fluid yet on terms of the date, but so people can do a walkthrough and they can meet the staff and I know there's been some interest with one of the reporters from the area that wanted to see it. We'll coordinate with the RTI folks who are staffing the clinic in terms of trying to figure out a date. With
I was
that,
also thinking about when we can do an open house. My initial thought was to get some of the elected folks here to get back into the conversation.
right.
And
Okay.
now that we're being redistricted, I absolutely will not ask them to attend.
Okay.
I don't know if you saw what's happening here.
I briefly saw it, but I've lost. I
We're
saw it this
losing
morning.
Delgado, who's been
Right.
quite the champion for us, and
Yes.
getting stuck with Stefanik, who has voted no on everything PFAS.
Mhm.
We're losing Daphne Jordan, who has never been here anyway, so I didn't think that was going to be a big loss. But now we're getting stuck with Sue Sorrento, is that her name or whatever? And I went and checked her Twitter page. She does nothing on the environment at all.
Environment.
So that's not a bad swap because neither one did nothing or so. But I don't know if we can maybe get Jake Ashby here because his district just got widened. But he'd
Okay.
be like the only elected official
Okay. All
I'd
right.
ask to come because they have not at all been engaged in the PFAS. They don't show up at our meetings.
Yeah.
But Jeff Wysocki and what's his other face? Bruce something. I've never even met the guy. Oh, he came to
Kateri.
one CPWG committee hearing way back in the beginning, mad because he didn't get invited to talk or something, if I remember that correctly. Never heard from him again. So even our local, other than Rob, our local electeds are just out of the conversation. So maybe that's something the CPWG can work on too.
Okay. All right. Yeah, that's a good, I knew.
I'd certainly invite Stefanik, but I doubt she'll come.
Yeah, because this isn't, I don't sense, this isn't an issue of discussion that folks around Watertown are talking about. So,
Yeah.
Yeah, we'll see. Okay. All right. That's good. I
Yeah,
did see a headline that you were being redistricted. I just didn't know what the,
We're crying.
in what
We're
way. Yeah,
crying.
that is a change. It's a big
They said they're gonna bring it
Yeah,
to court, so maybe we'll get Delgado for a while.
Yeah, well, if you keep reading, the courts often don't intervene.
right.
So it's
Gloria,
just, now it's just planning it.
Yeah. Gloria, you had something?
Yeah, I just wanted for everyone, for the shares, Lorraine and Emily, if you are wanting to coordinate anything for us to be at any events and you're emailing with any of the organizers or directors of those events, just to include the PFAS email, and you can introduce myself and Elisa, and I'll help, move it along, or if I need any questions answered, I can do that right away. So just be sure to include the PFAS study email, and then I can respond to whatever they need right away.
Great, we'll do.
Yeah, Gloria's been really helpful with planning things. And as I said, we're meeting next week to assemble a packet of information for you to use for your own social media to add. So we'll coordinate that and get that to you as soon as possible. So in terms of scheduling, we'll obviously do the school board on the 17th. I'm on CPWG on the 22nd. The village of Hoosick and the village meetings and town board. What do you think there? Should we schedule a meeting there? Should we invite them to come do a walkthrough at the clinic? What do you think?
That would be nice to invite them. Their next meeting is Tuesday. It's always the second Tuesday of the month. So I don't know, okay, if you can get asked to get heard on the 8th, or if it's too late, shouldn't be. But inviting the village board to do a tour would be nice.
Okay. I mean, we could even coordinate that for if they have second of the month for the meeting in March and have them come down. I mean, it's right there. So
yeah, it's perfect timing, actually.
Idea. Okay. All right. So we'll consider that date. And then Petersburg. I know you have there's a town board meeting in February, but I'm almost wondering if the one later in March might make more sense, and then time our mailings for the end of March for Petersburg. Does that make sense to you?
Yeah, I think that works pretty well.
Okay.
We did throw out to the town board at the last meeting that there might be an open house, and we get this unusual response from them. There can't be more than 2 Petersburg Town Board members in any room at the same time. Otherwise, they have to have a quorum, and then it has to be an official meeting, and it has to be documented and this and that. So we're not sure where we stand on that idea. I don't know if Emily's ever experienced that when she lived in this town, or if the Hoosick Falls people ever heard that from their town board members.
No, it's true. It really is true. They can't congregate. But they can obviously pick one person,
Right.
you know.
So that was our suggestion, to maybe have our new supervisor go and bring one other person to the open house whenever that lands. Our comment to them was, boy, you guys can't even go out and you can't even go have a beer.
They can't have a beer. They can't go to the St. Patrick's Day parade.
Right. The CFOA table, beer truck.
It'd be interesting to learn the history of that, but that's but I'm all for, they have a system. So
yeah, it's probably in the best interest to keep everything open.
Yeah, we don't need to, we want to provide information. So I think we'll require, now again, the question, do we go through you to schedule for the agenda in March, or do we email them directly? What do you think?
we would get you on the agenda for the third Monday in March. And then what we try to do is have it quoted as a special meeting and have you go first, right
Okay.
after the pledge, so you don't have to wait 2 hours.
Okay.
So we would do that so you can do your presentation, take any questions, and head for the door. Otherwise, you could be there for a couple hours. So that's
Okay.
how we're going to work that.
We
But
can do that.
we'll get you on the agenda, and then I would definitely follow up with an email.
Okay.
And we'll let you know how that process goes, and we'll keep you, in the loop on that.
And, so there are these initial meetings, and then, we'll get all this scoped out for February and March, and we'll send a list with dates and in a plan as we pull the notes together. But then, as I mentioned, I anticipate these mailings going all the way through June. So what we'd like to do is schedule a few things between, to be fairly consistent in our presence there, so that if people have questions and they know about the study, and certainly all of you, as we hang up posters, we'll get, once the ground thaws, we'll get lawn signs and things like that, so that people don't forget, that it is ongoing. It will take us through June to get everyone enrolled and into the clinics spaces for that. And so as you hear about events or different ideas pop in your head, just let us know, because we do need to kind of consistently schedule things throughout June. We want to be transparent and accessible, and make sure people understand what's happening and have their questions answered.
I had one other idea, Erin. Tonight, hang on, I just missed the ATSDR is doing a draft health consultation for Merrimack
Okay.
on PFAS. And while I've mentioned this to Patrick Bracey before, no one remembers them ever giving consultation, CDC or ATS, to anyone in Hoosick Falls. They
Okay.
were here when EPA made the announcement to stop drinking our water, which was back in 2016, January. But no one's ever done any sort of a panel or anything.
Okay.
And if we could get someone from CDC to come while we're, having people come in for the study and answer some health questions, I think there might be some more interest in that, and especially might get people more interested in wanting to sign up.
Yeah.
Because I don't, Emily, am I wrong? I don't recall anyone here other than DOH trying to stick us with some dude that knew nothing about PFAS, and he practically got tarred and feathered out of here. I don't know, it was really bad. I don't recall any other presentations from CDC or AT, and since they are part of this study, it might roll in nicely together.
Okay.
What do you think?
I agree.
Okay. All right. We'll look into that. That's actually, it's a really good,
Because
good
the Petersburg
question.
folks could come too.
Oh, yeah.
Is that something that would happen virtually or in person? You're thinking, Lori?
Well, I suppose it depends. I don't know what it takes to get someone from CDC here. So, given is that a month or two out? I don't know how. Again, depending on the numbers, if it's March, April, and the numbers have really gone down, we could still do spacing and chairs, because the armory's huge.
How are they doing the event tonight? Do you know?
It's via Zoom.
It's via Zoom. Do you have a flyer for that or an email?
I have the link. Yeah.
Okay. So if you could forward that, then we'll look into it. We'll see who coordinates that.
Let's see. I just got that join webinar button. Let me see if I can find the.
Okay.
Why don't I just forward this GoToWebinar thing to you?
Yep. Wait, and then we can. That's perfect. We can figure that out.
And it starts at 6:30.
That actually
Who do you want me to
reminds,
send that to? Just you, or?
you can just do PFAS@albany.edu. And I'll put my.
All right, I put you
investigative
both on there.
staff on it.
So I'm interested to see what they're gonna say to the,
Yeah.
since
Okay.
it's the same polluter.
Yeah, no, that's really interesting.
Yeah, okay, I just sent it.
Thank you very much.
Welcome.
I can't recall. Did we forward you already the list of potential providers to communicate with? To double
Yes.
check? And you,
Oh,
oh,
you
yes,
did.
you did, because you sent us some corrections.
Yep,
And so I think the next stage of that is to, I think we'll resend it because we had some additions to it just to double check, and that'll be an initial list. So there are several communications we want to do with the providers. One is drafting a letter so they know that the study has started in case they get questions, and we'll provide the fact sheet and some information. But then as the study moves on and people start getting their reports, we know that they're going to have questions. So we want to keep the providers in the loop, and as we gather information for them, but also host webinars or Q&As or be available to answer questions if they have them. So we want to continue the communication with them all the way through.
have you
the
reached out to the
process.
local health providers about putting the, you know, the bulletins up in their offices?
Oh, we could do that too. We can include that and see if they're willing to do that. So we'll definitely.
Twin Rivers
look at that.
specifically, because they
Yeah,
serve
okay.
so many people. Yeah, because if they can have the information out on their tables, you know, by the chairs or posted up on, they got
Sure.
some stuff.
Okay, we can do that. Okay. Any other ideas or questions?
Aaron, we
Yeah.
didn't talk about the Berlin School Board, and we're just not sure how many children
Yeah.
from Petersburg that would involve.
We might be able to look into that and see who's eligible with the wells, and we might know. I can talk to Betsy to see if we know how many children that might be, but you're correct that if we are going to enroll some children, we need to reach out to the Berlin School District. So let us do some investigating on our end to see if we can kind of get a sense if we will have children that potentially can be enrolled from that school district, and then obviously happy to meet with the school district.
Yeah,
And,
even, I mean,
okay.
I don't know if you have to meet with them, but definitely the school nurses and administrators and the
Okay.
board superintendent should at least be aware that it's going on.
Absolutely.
We had someone on our CA committee that worked in the district, and we were going to at least get some preliminary numbers for you of how many children in go to the,
Yeah.
you know, that would fall in that age range, but we haven't seen her in a while.
Well, and even, you know, again, the importance of this study is what we find and what we measure will be, the findings will apply to all communities and all people. So if there was interest, even if we're not necessarily enrolling a lot of children from the Berlin School District, but there were questions and people wanted to do what I've done previously, which is just giving an overview of PFAS. What are the, you know, what do we know so far? What is the status of the research in the field and what we're doing on the website? I'm always happy to give those talks and to, you know, invite people to look at the website where we have that information. The National Academy report should be out sometime early summer. That is also, you know, we could have some events around that as well when that's released. So, you know, I'm always happy if people just want to know in general what the issues are, that, you know, always extend that invitation, because that's important in addition to the things we're doing specifically around recruitment.
I know that our new town board supervisor, she has small children who are in the school district. She would be particularly interested to find out
Okay.
about this.
So maybe when I talk to the town board, that would be a good time to bring that up but we'll definitely follow up quickly to see if we think there'll be children that might be eligible based on the well levels and who are still living in the Petersburg area or had that exposure, or if they've moved away, they're obviously still eligible. So we'll see if we can get an estimate on that. But we're happy to get on the Berlin School District's schedule.
Okay, good. Thank you.
Thank you for that. Anything else? Is anything come up with CPWG? I'll talk to them about the study on the 22nd. Does anything come up in the meetings that people specifically might want to know about? They've seen me a lot, so but which is good. I didn't know if there's anything I knew. I'll obviously walk them through the study. So we'll have, if anyone, we sent out posters and fact sheets to Lorraine today. If anyone else would like some that hasn't already received them, let us know. Again, just keep sending a request to that email and we're happy to get those to you. Any ideas you have for spreading the word. And then the other piece that's really critical too is as you start talking to people and as you go through and you get feedback on the study, by all means, let us know. Just especially if it's something that we can respond to. So just let us know what you're hearing and other ideas. And again, as I think I'm really hopeful that in another couple of weeks we'll have a better sense of the numbers for COVID, and then we can more specifically the next meeting talk about a date for an open house and who to invite and what it should look like in time and things like that.
I had two,
Yeah.
trying to remember them. When do people start getting individual reports back?
We're trying to get a handle on that. So they're going to have multiple things come at different
Right.
time points. So the clinical results are, because those are going, we'll get those results back sooner. I think it's still going to take several weeks, and then we review them and send out a letter. The environmental results, the PFAS level results, will take quite some time because they're going to analyze all of those together from all the sites at the CDC lab. And that's to meet the scientific rigor. If people don't have their biomonitoring, didn't do biomonitoring and don't have the results, again, and actually I can add this to our list. We can add directions. If people, they can still call the number at DOH to get a measurement if they're not sure and they would like to know sooner. There is one clinical measure that might take some time. I'll look that up. There is one that's going to a different lab on its own. It's here.
Those all the metals and stuff.
The metals analysis, thank you. We're measuring here at the Wadsworth lab, which is the lab that does the lead measurements for this state. Those will take some, we're going to do those in year 4. We'll do those next year. So in the fall, we'll be able to send those into the lab for analysis. It's from a budget standpoint. We gotta get everyone collected. So those results should come back in about a year or less. I mean, but it's going to be in between the clinical results and the PFAS results.
So it's phased, so I can just
It's
tell people when
phases.
they ask,
Yeah,
it's gonna be
forget it in
phased out.
phases.
Okay.
And we'll every time, and so we'll roll it out as we get them, but it'll be in phases. So the clinical results will come first, then the metals, then the PFAS. And again, we're happy to always answer questions. And as things start rolling out, we'll make sure the providers know so that they know what questions to anticipate.
And I got a couple on the gift cards. Are they given to you that day, and what are they?
There's, go ahead, Gloria.
Yes, so for each portion of the study that's completed, the participants get $25 and they receive the gift card as they complete it. So when you'll do the telephone interview online, on the phone, and then when they come for the clinic visit, they can get both cards. If for some reason they don't show up for the clinic visit, we'll still owe them that gift card, and we'll figure something out with that, Erin. But yeah, so they receive the $25 for each portion they complete. So the telephone 25 and the clinic visit 25.
But what are they? They're not like
What's-
Walmart or Amazon, or are
It's
they like little
Visa
Visa
gift card.
cash cards? Okay.
You can use them wherever you want.
Somewhere.
Yeah, I had somebody write me and say, well, I don't order through Amazon, so I hope it's not
No.
one of those. And I was like, I don't know what they are.
No, it's Visa. We did that with one study. We actually had options for people, and it just got so confusing. And there's a lot of emotion around what stores. So the Visa works well. And then the children.
Right.
So the children are being asked to come back in for the neurobehavioral assessments, and they will get through their
Another
parents,
25.
another $25 Visa card.
Great, thank you. That will help.
That's good. That's a good reminder that we should, we can put that in, what to provide that level of detail.
I never even thought to ask till someone asked me.
Yeah,
And I was
no,
like,
that's a good question.
I don't know.
That's good. So thank you.
A little off topic, but it's nice today that PFAS is going more into the health arena. I don't know if you know, Less Cancer Org is having a 3-day workshop,
Okay.
and it started today, and today was day all PFAS.
Oh,
And they
wow.
had some
Okay.
great presenters, doctors, community members, senators. It was fantastic for a big cancer org like them to have a full day on
Yeah,
PFAS. So that was
that's
great
really
to
good.
see.
No, I'm glad they did that and provide that level of information is really critical.
Yeah,
And
it was
I
great.
think the last I heard is that NC State, the Superfund Center at NC State is going to host the PFAS conference in June.
June 15th,
June 15th to
16th, and
17th.
17th. Yeah, we were already, because like we
You're gonna
were
go?
working on that through in the coalition.
So we'll talk about that.
Yeah, 15th, 16th, 17th.
17th. Unfortunately, those are the exact same dates that the School of Public Health has their site visit for accreditation. So I'm not going to be able to go.
So I can't put
I
you
was
up
like,
for speaking. I was gonna
I
do
know,
that.
I would never, I mean, I could possibly do something remotely. I just can't I can't leave because I have to be here for the site visit, but I could possibly do something if they do have that option. And I can talk to Jane Hoppin too, but if, yeah, she told me the dates. I said, you couldn't like do it the week before after, but we can definitely talk. And if, as it gets closer to, there might be others from here that can go down.
Okay,
I just can't be there in person.
Bummer.
I know, I would trust me, I would much rather be in North Carolina for the conference. But so
It looks like it's all going to be really science-based this time.
Yeah, I think, and Jane, I know Jane Hoppin pretty well from my North Carolina, because I lived in Chapel Hill and for a while, and that's where I trained. And so it's a really good group there. So they're going to have, it'll be a good conference. And,
Yeah, I can't wait to see Jamie do it again. She's so lovely.
Yeah.
So sorry, off topic.
Oh, it's good. Those are the kinds of things, and we'll get that information up on the website too. As we do that. Okay. Anything else? We'll gather some notes together and send you. I think we can do quite a bit of communication via email. But once I'll be on tour here the next couple of weeks with various boards, both in Hoosick and in Newburgh. And maybe if it's okay with you, we'll schedule another meeting for early March. But we might reach out to you before then with some possible dates as we start figuring out an open house idea.
And I will pop you an email on my visit tomorrow after the visit.
Okay, that's great. Yeah, I saw the talking points and things. So yeah. Oh, that visit. Yes.
Tomorrow's visit. Tomorrow morning. Yeah.
Yeah,
Because my
definitely.
daughter's going too, and she's kind of
Great.
pissy. So if she has a good time, then that says something.
Okay, that's good to know. Yeah, no,
I mean, we had the phone dude, Tom, I guess his name was, from Newark, called, and sad boy, he got to do our phone interviews, and we just had him cracking up left and right.
Well, I'm glad you got that piece done, and definitely send us feedback and let us know. And anything, even if it seems small, let us know, because anything we can do to make it easier for folks.
Absolutely will.
That's all I had. I just really wanted to reach out to you and thank all of you for all of your input and all of your hard work, both on this study and everything you're doing with PFAS and helping us, enroll people and get the word out. And just, again, we open door via phone, email, always. So as ideas, just let us know. And feel free to call and contact us, and we're always willing to meet with folks. So just keep us posted on things.
Thanks for all your guys' work too. Seriously, this is good. I think it's gonna be great. Really excited.
I'm very happy we were finally able to launch, even though it's the middle of winter. And all the things you're not supposed to do when you start a study, we're doing in terms of the weather and the timing and all that. But it's good.
Well, also a good reason why, the sign up is gonna be so spread out and how
Yeah.
long you have is because
Wow.
then you're bringing us into spring, which is great.
Right. So we'll get there. Plus, I keep telling people who are in the south, we're hardy up here in New York. May not like ice, but we're fine in snow. And so we'll get there. But we're excited, and I think we've had a number of people call in and do the eligibility screen and get scheduled. So that's, as we hope, as word gets out, that'll keep increasing. So that'll be great. All right, that's all I have. So thank you. Stay safe in the next few days with this storm. And again, just email us if you have any questions or have ideas.
Great.
All right.
Thank you so much.